Welcome aboard. This is the Admiral's Almanac, your leadership life connection, bringing leaders from all walks of life into yours so you can take charge, improve your leadership, and improve your life. With the wit and wisdom of your host, Rear Admiral Gary Hall.
And welcome to the Admiral's Almanac. I'm your host, Gary Hall, and today I'm joined by my colleague, Adriana Sanford from the Sanford and Hall Report, and we have an opportunity to sit down with Dr. Valter Longo. Dr. Longo was selected in 2018 by Time magazine as the world's most influential nutrition and health expert for his research on nutrition and fast mimicking diets to improve health and prevent disease. Dr. Longo is the best-selling author of The Longevity Diet. He has graciously donated royalties from book sales to the Create Cures Foundation to continue to fund and support charitable activities. So let's jump in and join Adriana and myself talking to Dr. Longo. Today we have a wonderful guest, Dr. Valter Longo. Dr. Longo is the director of Southern California's Longevity Institute, where he focuses on nutrition, fasting diets, and chronic diseases.
Dr. Longo actually was featured by Time magazine in 2018 among the top 50 in healthcare and the only one on nutrition.
And also, as we approach the holiday seasons and the new year, everybody's thinking about their health, their wellness, diets, exercise, etc. So it's a great opportunity to have Dr. Longo with us. But now, as a biogerontologist, how did you wind up there? You started off wanting to be a rock star. So how did music, a musician and a rock star, get to be a biogerontologist?
Yeah, so I came from Italy to the U.S. To be a rock guitar player, which I got to do for a while. And then at some point at UCLA, I was asked to pick either music or science, and I picked science. I was actually touring for a while I was doing my PhD at UCLA with the band. And but then, of course, I had to choose, and I selected the science because it's really where my biggest passion is. I mean, music is still a passion, but not at the level of aging. And I thought aging was just an incredible opportunity to do science and be a scientist and investigate one of the most complicated topics in existence. But I also thought from very early on, when I was 19 years old, actually, I switched to biochemistry to study aging. And at that time, I thought also that this would be at the very center of diseases, right? Cancer, cardiovascular disease, Alzheimer, diabetes, etc. So it was just a great opportunity to both do science and medicine.
Dr. Longo, I think that you made a great choice that benefits all of us. Now, I'm an engineer and I've worked in a technical field and I think in a technical engineering way, but now also in my field, I've had many musicians that use a different approach. Do you think that music has helped you in your research?
Yes, very much. And I think that I recommend to scientists or whoever wants to be a scientist to also spend a lot of time with creative learning. And so whether it's music or some other art form. And I think because it just pushes you to think different, it pushes you to begin thinking about things that nobody else has done, right? So you have that in composition, you have that task. And so whenever most people in science tend to learn from somebody and then continue on that track. And but if you're a musician or an artist, you have this instinct of trying to come up with something that's just you, and that helps, I think, particularly in medicine, right? Because it just helps looking at diseases, for example, in a very different way. Certainly helped in our work on cancer and diabetes and Alzheimer's, etc.
Well, and this is why they say it's so important. Originally, we had STEM, and that's science, technology, engineering, and mathematics. And today, they're focused on STEAM, STEAM, the A for STEAM is the arts, because they said the ability to think creatively is so important.
You witnessed a bicycle accident. Can you tell us that story about how that changed your approach to health and wellness?
Yes, so this was actually at UCLA. I kept hearing in the early days of my PhD, I kept hearing the trucks, the fire trucks going by. And then one day I just decided I'm going to follow one. When I got there, it was 2 police cars, the police ambulance, and the fire truck. And I thought, well, amazing, right? So when somebody falls off the bike, incredible what we do for somebody that just had a minor bike accident, a bicycle accident. But, if you have cancer, often you see an oncologist and that's it. And lots of times it may be an oncologist for 30 minutes. We hear this all the time from cancer patients. This team approach in the fire department, the police adopt should certainly be available to somebody that's advanced stage diseases, right? So if you have cancer of any kind, you should have, I think, a physician, an oncologist, but also a molecular biologist that's working on your case, a nutritionist, a dietitian, and a psychologist, right? So that team, I think, is just largely non-existent. Some cancer and other hospitals, cancer centers and other hospitals have it, but it's pretty rare.
Why do you think that is? Why is it that we are not more focused, especially, I would say now in times of COVID, when we realize that a lot of individuals that are actually dying have one or more serious illnesses or underlying condition. Why hasn't this approach been looked at a little closer, this integrative intervention?
I think it's in part because it's been medicine, it's really been physician-centered. And I think it was fine until maybe 10 years ago when the medical data, the medical sciences were going, fairly slow in coming up with new interventions. And so now I think that the science is moving very fast and the medicine is moving very slow. So the FDA, it takes a long time, and for COVID, for example, we saw an example of everybody got together. And so everybody gets together and you have now a vaccine in a matter of, a year or so. And that took scientists, it took the mathematician, the virologist, the epidemiologist, the emergency physicians, et cetera, et cetera. And so we just don't use that. And I'm not sure is anybody responsible. It's just that traditionally we just had the doctor, and we're just continuing on with just one man or woman centered intervention. Now, I would say most physicians will welcome having somebody. Let's say you have a cancer patient. I do this almost every day, right? So the patient contacts us, and the patient is working with an oncologist. And so we move in and start thinking, okay, maybe whether it's fasting or another intervention, maybe it's going to take 10 years for the FDA to have that approved. But what do we do now? And since this patient is asking, saying, I'm going to get chemo in a week from now, right? So I can't say, we're going to run clinical trials and maybe 10 years from now we can help you. They don't have 10 years yet. So, I go around the world and from South America to Europe and Asia. It's pretty much the same everywhere, right? So it's really medicine is very powerful in regulating. The medical field is very powerful in regulating how everything is done, right? And for good reasons, right? I mean, drugs can be dangerous and improvised approaches can be dangerous. So I'm not blaming the system for being very careful and wanting FDA approval for everything, but it's just not enough anymore, So it needs to. So, for example, the FDA has something called compassionate use, but it's rarely used by doctors. Right? Compassionate use basically says if you have an advanced stage disease, you can look at the science and utilize drugs that might not be FDA approved or anything, even nutritional, that might not be FDA approved, just because you don't have time to wait for that process. And so it's doable, but nobody does.
Mm-hmm. But I think more awareness is needed that there are other alternatives, that there are other approaches available. Besides chemo, there is something else that can help you. And right now, we have a $1.5 trillion market in health and wellness. People are starting to realize how important this is. And maybe with more awareness, it will open up, maybe all over the world, maybe at the same time. COVID has really opened our eyes to a lot of things. And probably one of the most important right now with regards to this global threat is finding new solutions, new ways of tackling this problem.
And not only new solutions, we must find better and cheaper, right? So the cost of healthcare is through the roof, and every new drug is going to just add to the cost. So it's going to get more and more expensive. So that's why I think there's not a consensus, but certainly lots of people, experts believe nutrition is going to have to be at the center of medicine because it's going to be by far the cheapest way to intervene, prevent diseases for sure, but also treat diseases. Now we have many clinical trials, which I think we're going to talk about, in which we're combining the nutritional approaches with the standard of care to treat all kinds of diseases.
Dr. Longo, you mentioned nutrition long-term and for preventing disease and for treating. Now, I talked to an oncologist with my wife at present, and she said, shouldn't Gary be on such and such a diet to combat cancer? And they said, well, you should have started that diet 10 years ago. So is there something that we can do nutrition-wise to prevent but also to treat, rather than saying, well, you should have started that diet 10 years ago? Does that make sense?
No, it does not. And it makes sense that somebody, not trained in this would say that, right? Because most physicians receive one or no courses on nutrition, and so it might not be that intuitive, right? That you can start today, right? So if you start today. We run clinical trials that we know, for example, this growth factor called IGF-1, which is at the center of many cancers. Within a couple of days of you changing the diet, even without fasting, just going into a lower protein or more of a vegan protein diet, this IGF-1 goes sharply down, right? So within a few days, you can already change the risk factors for cancer: glucose, insulin, IGF-1. Definitely not 10 years, a few days to change. Of course, there's a cumulative effect, right? So it is true that if you've been doing something for 20, 30 years, that helps you even more than just the change, that huge change that you may have had by changing the diet 3 days ago.
Gary, you bring up a great point, because I think, when we think of this topic, we think about those that already have the illness and or are fighting and are in treatment, but we don't really focus too much, and maybe because there's not a lot of awareness on, the childhood. And if you have smaller children, is this something that we should be considering for them as well?
Yes. So this is the other extreme, right? So, you're not starting today, you're not starting 10 years ago. What about if you start, at the very beginning? Yes, absolutely. So, for example, I published a book for now, just in Italy, focused on children and children nutrition and the effect on longevity. And one example that we had in there was diabetes, and showing that the children that were overweight or obese continuously between the age of 7 and 18 had a 400% increase, fourfold increase in the chance of developing diabetes. Right? So this is how important and essential it is to start as early as possible. But again, if you didn't start as early as possible, it's okay. You can start now, and that we know can make a big difference still.
Well, and I think what would happen is if your child is used to certain foods, later in life those become comfort foods, right? So if you're feeding them Doritos, later it's harder to take them away.
Yeah.
Am I right, or is that?
No, you're right. You're absolutely right. That's one aspect. The other aspect is molecular, right? The body is actually changed into a molecular state that keeps you at a certain weight. So the system, and it's probably for evolutionary reason. And once it knows that you're stable, at a certain weight. Let's say that somebody's 10 pounds overweight. Once you're stable at that level, then the system tends to want to keep you there. And to switch, to take out that luck, it's tricky. And so fasting, for example, fasting mimicking diet it seems to be taking people out of that and signaling the need to return to a lower weight state, right? But there's a very powerful program that keeps you at a certain weight.
Now that book, we're going to get it in English too, correct? Is that coming?
Yes, that's coming, and that's going to be the foundation is going to publish it probably. So
are we expecting this in 2022, or when are we?
I think so. Yeah, I think that hopefully I think it's already translated, and hopefully soon we'll get to publish it.
Wonderful.
Well, childhood nutrition, even the United States military has determined that early childhood nutrition, children can then perform better academically, physically, mentally. And so I think it's not only a health challenge, it's a national security challenge to have better childhood nutrition. Now, Dr. Longo, you are the expert on fasting. Can you talk to us about fasting, your thoughts on it? Some people might think, that's an extreme process, but talk about fasting and fast mimicking diets so that we can better understand the process of fasting.
Yeah, so a long time ago, which is probably, say a couple of thousand years ago, the body was programmed to overeat or eat as much as possible during when food is available, right? And this probably was during the summer. When it's warm, there's more food, fruits and nuts, et cetera. And so people had an opportunity to overeat and actually gain weight and even become what's called insulin resistant, which is what diabetic people have. So then what happens there is that the body accumulates fat, and that has a purpose, right? That's the purpose of making you survive in the winter, right? So now we have food all the time, but we didn't have food all the time. And so you have to make it through, let's say, January, February, March possibly, and might have almost no food at all. So that fat now becomes your energy, your source of energy. And so as things change, then we abandon, of course, we still have the overeating part, right? But we abandon the fasting part. Mm-hmm. And so this is really at the center of our history. We always did it. And now we have part A and part B never comes. Mm-hmm. And this is why we're seeing this fasting serving as that unlocking mechanism for this, let me put fat away. And because now the signal to the brain is now I want to use that fat. I don't want to store it anymore. Now it's time to use it. We're fasting. So it's really remarkable, again, how fundamental. So I've been asking recently a question, is diabetes a disease at all, right? Or is it really a temporary state that is completely reversible? And that's what we're seeing now with clinical data, and it's no longer just an idea. So it seems to be a temporary state there to help you, not to hurt you. So interesting, right? When you bring the science in, how something like diabetes, one of the most widely occurring diseases in the world, may be not a disease at all.
Being remote and being home, you've got two different groups right now. You've got one group that has, and I would say maybe everyone has gained that, COVID-20, but you've got one group that continues to work and is working more hours and sending more emails. And then you've got another group that actually is starting to look for that balance, that work-life balance, and looking for maybe taking walks and trying to do this. You're mentioning the diet, this fasting. Can you go too far? Can you fast for too many days? And what happens if you do that? Or if you do the fast mimicking instead of a week? What if you do it for 3 weeks? Does that have an effect on your body? Because maybe somebody will say, okay, this helped me, and I've got those 20 pounds to lose, the COVID-20, so I'm going to do it for 3 weeks or 4 weeks.
Yeah, this is why it's so important on one side to say the medical system is not doing enough, but on the other side, saying the medical system is essential. And so what do I mean by that? I mean that we cannot improvise, right? So the moment that you let people, the moment that people, you tell people, oh, fasting is good for you. I always say fasting means nothing. It's just a word. It's like eating. What does it mean to be eating? Is that good for you or bad for you? So fasting becomes good for you if you do it at the right time, for the right length, with the right composition. Mm-hmm. So what does it mean? So for example, having worked on this for 30 years now, and we came up with something that is 5 days long. But when we first started doing trials on cancer patients, we realized that water-only fasting, even for 3 or 4 days, was not easy for the patient, and the oncologist did not want this at all. So then we came up with what we call fasting mimicking diet. And then we did a lot of basic work.
So you actually can get some food in that one.
Yeah, so the fasting mimicking diet is something that lasting for cancer patients 4 days, for normal people 5 days, that allows you to eat as much as possible, not a lot, but enough, and get the effects of fasting, right? So and then there are other fasting which don't require a kit, like for example, fasting for 12 hours a day. That seems to be very safe and very effective. But those, I think, are two of the only fasting methods that I believe are very helpful for people. Then there are other type of fasting that people fast, for 1 day a week, 1 day a month, and those may be okay, but there's just not enough data on them. So, my suggestion would be very careful and in deciding what to do, because this improvisation, you were asking what happens if you do 3 weeks. Well, we know that eventually your body slows metabolism, and that metabolism slowing now can last 3 years. And so if you go too far, now the body detects a starvation environment and doesn't want to burn fat anymore, because it basically wants to survive, and now has to slow down and get into what's called.
So it's the opposite of what you want, because if you're trying to use this to not only cleanse your body but also lose weight, it's not going to work. You do not want to go longer than you should, because it's going to slow down your system.
Yes. You don't want to go too short, and you don't want to go too long, because too short is not enough to switch into a fat burning mode. And too long gets you eventually into a thrifty mode. The system detects, lack of food long term, and then it just wants to save energy as much as possible. So it doesn't want to burn fat anymore.
What's really important to note is the advice provided right now by Dr. Longo is just general information. If you are considering fasting or fast mimicking, you want to make sure that you're doing this correctly. It's not something you want to just try at home. And remember, each person has a different composition, and you may or may not know what serious illness may be in your DNA.
We're talking about even in normal people, you have to at some point see an expert or either a physician that knows what they're doing with fasting, or a dietitian that knows what they're doing with fasting. Now, once you get to diseases, now you really need a team. So you can't. So at the foundation, the foundation clinic, we have a team, and they're of dietitians. They're used to work with the physicians in whatever disease, endocrinologists for diabetes, oncologists, et cetera, et cetera. So, yeah, that's very important. And the only exception is probably the 12 hours fasting. I think the 12 hours.
12 hours, 16 hours, I've heard different. What's good, what's not?
Well, so 12 hours, I think you don't need to see anyone, meaning that if you're going to eat, say, 8 a.m. to 8 p.m. and then fast 8 p.m. to 8 a.m., right? That's, I've never seen a negative study about that. If you're normal and you don't have any particular condition, it should be fine. And even most people with most diseases, this should still be fine. As you get to even 16 hours a day, let's say 16, 8, now it gets into much more tricky territory, right? So, for example, skipping breakfast is not a good idea. Lots of studies are now showing that this is going to shorten your life, or it's associated with a shortened life, let's say, right? Which is not a good thing, right? And also gallstone and gallbladder operations, people that fast for 16, 18 hours a day, they tend to have more problem in the gallbladder. So I would say
breakfast is a must.
Breakfast is a must, and stick with 12 hours. Then you can see a physician, there's an expert in this, or a dietitian. Maybe for a brief period, the 16-hour fasting can be adopted. But we've always much more favored this, let's say once every 3 months, once every 4 months fasting mimicking diet, also allowing you to do a longer fast, much more like the fast we used to do. Let's say, you overate in the summer, and then you get to December, you still have some food, but not very much, right? So, and you might go 5 or 6 days without food and then get it again. So I think this may have, there may be a reason why this 5-day FMD works so well, maybe because it's reminiscent of some of the conditions that people face in the winter.
Well, Dr. Longo, we're glad that you chose science over music because you're making a difference worldwide in longevity, but you are the rock star of nutrition, wellness, and longevity. And for our listeners, you can get his book, The Longevity Diet, either in an audio book or a physical book at Amazon. And you can Google Create Cures Foundation to learn more about his foundation. And gosh, what a great discussion today.
This is great for New Year's resolutions. If you're looking at what you're going to do for next year, start early and get the book or get the recipes and start the process.
Yes.
And thank you for listening to this episode of the Admiral's Almanac with Dr. Valter Longo, the best-selling author of The Longevity Diet. At no time do we offer or recommend medical or dietary advice. This episode is just to give you some insight. So consult your physician or primary care provider and maybe get a copy of The Longevity Diet to learn more about fast mimicking and fasting in general. And don't forget to subscribe to the Admiral's Almanac wherever you get your podcasts. And until we meet again, here's wishing you a happy voyage home.